Hello, everyone. I'm Teresa Miceli, one of the Nurse Leadership Board members for the International Myeloma Foundation. And I come to you today from the American Society of Hematology meeting as one of the support group leaders and the nurse liaison for this marvelous program. I've had the pleasure to spend the last few days with a variety of patient advocates who run support groups throughout the country, and we have been making our way through many sessions on multiple myeloma. This morning, we attended a session that really, I think, is very pivotal on the use of therapies, excluding transplant and such things as antibodies and targeted therapies. One of the drugs that was highlighted in two of the sessions is new to the world of myeloma called selinexor. This is a drug promoted by Karyopharm, and it's first in its class. It's an XPO1 inhibitor, and it's being used in combination with therapies like daratumumab, and really looking to have great efficacy in patients that have been highly pretreated, heavily pretreated, and refractory to so many of our standard therapies. I'm excited about this. I'm also well aware that there's some side effects that can be experienced from this medication, in particular things like GI disturbance, nausea, diarrhea. And for many patients, fatigue is just a constant issue regardless of what therapy they're on. An interesting side effect of this drug that is different for this therapy compared to many of our other therapies that we're familiar with is the idea of low sodium levels in the blood, or hyponatremia. And so keeping these things in consideration as we look to having another therapy available in our armamentarium, we really need to look at what the side effect profile is, how we can manage this, and really help patients to stay on these therapies. And I know that the members of the Karyopharm team are really looking at how these side effects can be better managed, again, so patients can stay on these very important therapies. I thought this was a very interesting and very promising review of the STORM and STOMP trials that are now ongoing using selinexor, and I'm hopeful that it'll be just in the near future that this drug is readily available to those patients who have used, benefited, and now failed all of the therapies that we have available. So keep your eyes open for selinexor. I really think it is on the horizon, and I'm looking forward to that being a new tool in our armamentarium. Thank you, and thank you for following the support group leaders at ASH.